me has been wonderful. It's the first place away from home that I have felt like is home. Working with such an amazing bunch of people, not just the nurses and the doctors, but everyone at the hospital. It's truly an amazing place to come. You always feel supported.
Broome ED, it's like a pretty decent sized regional department. We've got lots of patients that come from all over the Kimberley. So we are the kind of referral centre for the Kimberley. So we'll get our patients from Kununurra, Wyndham, Halls Creek, Fitzroy, Derby. They all come to Broome before they go to Perth usually. We have a resus bay, triage nurse. We also have a HDU attached to our ED, so that's pretty unique. So you not only work in the ED, but you also work in the high dependency units. We have patients there that are pretty complex and are pretty unwell a lot of the time. Instead of an ICU nurse looking after those patients, it's one of the ED nurses generally. So you kind of get to look after the really sick patients and practice your crit care skills, which you wouldn't normally get to do. You can really kind of practice, titrating your inotropes, having people on BiPAP, consulting with Royal Perth ICU, like all of those things. You can definitely come to Broome and work in our HDU here. If you've only ever worked in ED before and you've not had specific HDU experience, you can absolutely transition into that role. It's very well supported. We really try and invest in our staff for retention and just for providing good quality patient care. If you don't have your ED skills, you're wanting to try it out, or you're, worked in a tertiary department but you haven't been able to really progress yet, you can definitely come regional. And we've had a lot of junior staff over the last 18 months really progress in their learning and training. And some of them came with no ED experience and they're starting to triage now. So it's been really good to see them kind of like really come a long way. So from like that nervous first day of coming from a ward and really having no experience or idea on how to be a good ED nurse, and they've been supported by the team and they've been able to complete lots of training, and now they're kind of like working on those higher end critical care skills. So that's been really good.
It's very busy. It's getting busier by the day. We get everything up here. We get all the big traumas because we're the catchment for the Kimberley. Our doctors are some of the best that I've ever seen. We've got ALOs here that are fantastic, and we'll call upon on a daily basis if there's anything of concern that you're not sure if is culturally appropriate. Our ALOs, you can call up at any time and just ask them for advice, and they are always willing to help you out. And we're always, as senior staff, always happy to answer any questions and support people as much as we can so they can provide the best culturally appropriate care.
I really love the Kimberley as a place to live. Like, it's a great work-life balance. There's no shortage of restaurants. The cinema is amazing. It's a really good place to live. There's a fishing club, like for drinks on a Sunday afternoon, or the mangrove at high tide is beautiful.
Beaches are just like nothing else that you get in the world. They're amazing, and they're not busy like you have in a lot of places. So you can go to these just pristine beaches and there is no one there. A lot of outdoor activities to do in Broome, and that's primarily how we spend most of our time, is outside at the beach exploring.
There's weekend markets, they're awesome. You can get all your beautiful jewellery, and there's some beautiful Aboriginal art down there, and lots of people doing cool stuff. And then we've got night markets as well. It's always got good food, and it's good to have a walk down at Town Beach. Races are on at the moment. They're super fun, so they're on most weekends. There's just something about Broome, and it really gets under your skin, I feel, and you just, relax, and it's a beautiful vibe. It's a really nice way to live. I wasn't sure either moving up here. It's always a bit scary leaving home or coming to somewhere remote, but it's just been life-changing for me, and it's definitely the best thing I've ever done. And I think, it's probably a different type of nursing, and it's really challenging at times, but I think it definitely makes you a better nurse, and it's very eye-opening and quite humbling working up here.
I get lots of messages on Facebook being like, how are you ever going to come back to civilization? Or like, do you even work? Like, your life looks amazing. And it is beautiful. Like, we literally live in a holiday destination.